Now we move into another pretty common one. Still pretty common one. Hypertension. Yeah, hypertension. High blood pressure. Yeah, high blood pressure. So that's another pretty common illness. So basically, our blood pressure, we know we have systolic part and dystolic part. So normal range, yeah, normal range, 120 over 80. Generally speaking, yeah, generally speaking, yeah, 120 over 80. So that's basically. But if we diagnose for hypertension, usually we say people over 135 and over 90, or some book even talking about 95. So between still abnormal, but we are not truly diagnosis for patient hypertension. If truly over 135 and 90, then we diagnose it. And also remember, blood pressure is affected by a lot of issues, like people's stress, emotions, even after exercises, after eating. Their blood pressure will have a different degree kind of increase. So when diagnosis for hypertension for the patients, usually need at least 3 times in different days, not the same days, yeah, different days. And each time, like blood pressure is 135 over 90. So then we say that's patient have the illness, hypertension. Not only one time we measurement blood pressure. Sometimes people just temporary blood pressure increase. In that case, we are not a diagnosis for people hypertension. So that's the generally for this one. And the cause of the hypertension is still not truly clear. Still not truly clear. Something may be easily learning patient got high blood pressure, like people eating too much some animal fat or meat, and taking too much sodium. And also people like drinking alcohol for always lifestyle changing. So that's something, or maybe smoking. So that maybe easily cause people hypertension. So that's generally. So diagnosis, we're talking about, we need like over normal blood pressure, usually. So different book, they talking about a different number there. But truly, low part over 90, at least. Upper part over 130 or 35 at least. Some book mention 140. Then for different days, we take blood pressure at least 2 to 3 times. Then all the like each time over the number, then the patient maybe have hypertension. So blood circulation, blood circulation we know from the heart and through the blood vessels, sending blood to the tissue, and then the blood return back to the heart again, and from the heart go to the lung, and then send it back to the heart again. So that's blood circulation here. So high blood pressure means, generally say, in the blood circulations, mainly it's the pressure in the artery. So we test the blood pressure. It's the pressure in the artery. Diastolic is a heart chamber, especially ventricle control pressure. So pressure will be a little bit higher. Systolic, yes, systolic is the contractions of the ventricle of the heart. Diastolic is the ventricle of the heart relax time. So that's why we have like a different number there. So blood pressure disorder, pretty close relationship with the last illness. We talk about coronary artery disorder. And infections, both for blood pressure and coronary artery disorders. So we're talking about what's the medicine diagnosis. We say we have systolic and diastolic blood pressure. Thus, we use a special kind of machine, and we can test for how high of our blood pressures. And we say when we take the blood pressure, if one time is higher, we need a separate time to test it. And also, if patient just coming after walking, after eating, need to ask patient to sitting there about 20 minutes, then we test. So that's we say normally blood pressure in adults is around 120 over 80. But truly, if over 140, over 90, that's we can diagnose this patient for hypertension or high blood pressure. So hypertension, hypertension pretty easily cause the heart issue. Because like we just talking about, the heart bomb the blood, go to the blood vessel, go to circulations. You can think about if blood pressure in the arteries is pretty high there. So the heart need like a pretty stronger like contraction. Then they can pushing the blood go to circulations. So if not that too high, high blood pressure is bad. So basically, patient may not have heart problems. But if truly pressure is very, very high in the arteries, most people, same time, they will have heart problems. So basically, we're talking about cause the hypertension, pretty similar like the reasons caused before, like before eating too much fatty food, or maybe drinking alcohol, or maybe drink like cigarettes. So generally speaking, if patient have not a severe kind of hypertension and not caused heart problems yet, so basically these kind of patients from the beginning we are not necessary like use medication. We just tell the patients changing their lifestyle and changing their food they eat and do more exercises. So basically, these kind of changing may be cured the patient's hypertension. So including some people overweight, need some losing some weight, and also less taking solidum, do more exercises, so more relaxing. So these kind of patients truly can, without like drugs or medication, they can cure it. But for severe kind of hypertension kind of patients, or maybe like if mild kind of case, but we do a lot of like exercises, we change our lifestyle, still not like truly changing the blood pressure levels. Generally, we calculate by the time, like over a year. Yeah, over a year, still nothing changing. Still nothing changing. It's not like just 3 or 4 days will got a big change. But generally say up to a year still not changing. Then we need medication to help. So that's basically otherwise, like if patient's blood pressure keep high for long term, later on maybe cause the heart issues. So for Western medicine, we talking about treat hypertension. We have a different way to treat it. Yeah, different way to treat it. So general way. Firstly, we try to dilate blood vessels. Blood vessel dilate and the blood go to circulation amount the same. So pressure will be decreased. So that's one kind of category. Another category, we go to nervous systems. Nervous systems control the heartbeat, control how stronger, like the heart contractions. So we make it a little bit weaker there, then heart not pushing too harder. So that's still sending less blood go to circulation. Less blood go to circulation, then blood pressure will be decreased. So that's ACE inhibitors and the beta blockers. That's working for that way, for nervous system. And another category, we directly working for the calcium channel blocker. Calcium is pretty important for muscle contractions, not only for the heart cardiac muscles, also for like skeletal muscles. So without calcium, the people's muscles contractions will be weaker. So still decrease the heart contractions and then less blood sending to circulation. Then blood pressure will be decreased. So that's another category. And then another category, we say promote urination. Thus decrease the blood amount in the circulation. So we say that's kind of balance in there. Like blood go to the kidney, and the kidney look like a filter functions, relieve extra water in there. So that's kidney. So basically, the blood have more like circulation to the kidney, and if they have more relief from the urine, the blood amount will be decreased. Blood amount is decreased in the circulation. The blood pressure will be decreased. So that's basically by Western medicine aspect. We're talking about the treatment for high blood pressure. If we need to use medications, we separate 5 different categories here. But generally say, through relieve blood from promote urination, through the dilate blood vessels, decrease pressure, and also through the nervous systems, make the heart contractions little bit weaker, and also rate decrease, and also directly go to cardio channels, make heart not contraction so stronger. So that's for Western medicine aspect. Then we move into TCM part. So TCM part for hypertension, we still have different degree kind of hypertension, like mild degree. So from beginning, they may don't have symptoms. So basically our TCM illness, basically patient have some symptoms, and then we put in, they go to different illness, but they have different symptoms. So that's basically if patient no symptoms, we are not especially thinking about TCM illness. But if they have symptoms and signs, so generally hypertension kind of patient, they may have headache. So TCM words for headache we call 头痛. 头 is head, 痛 is pain. 头胀, 头 still high. 胀 means distension. So by different symptoms, we name it with different name. And 眩晕, that's dizziness or vertigo. 眩 is turning, 晕 is still turning kind of sensation. And if heart palpitations symptoms, we call 心 is heart, 急 is rushing heartbeat, palpitation. And sometimes people have with hypertension kind of illness, they are difficult to sleep, insomnia. So we call 不眠, 不 is not, 眠 is sleep, couldn't sleep. And sometimes people with hypertension, they may have numbness or maybe tingling kind of feeling in there. So we name it 麻木. Ma is numbness. Mu still losing feeling, kind of feeling. So that's generally speaking, we by different kind of symptoms, we name it a different name for TCM. Then we're talking about the different pattern and the treatment. So hypertension for TCM, mainly pattern relationship with the liver. That's mainly pattern. We say patient have hypertension, mainly symptoms, headache, dizziness, vertigo. So that's the mainly symptoms. So liver pattern, we're talking about the liver young hyperactive pattern here. Same meaning with liver fat. It belongs to excessive pattern. So heat rushing up, right face, and also right tongue, yellow tongue coating, very pulse or maybe rapid pulse. And the patient also possible have other symptoms like easy angry, difficult to fall asleep, insomnia, bitter taste in the mouth, and also possible tinnitus and more emotions. So that's generally liver excessive heat pattern. So we need to clear the liver or soothing the liver and clear heat and try low blood pressure. The patient high blood pressure. So the typical formula we use for this condition, 天麻钩藤饮. I believe this was still in our CCM list. And plus, 加减. So king herb for this one, 天麻 and 钩藤. These two herbs especially like a relieve internally wind conditions. So these patients truly have dizziness that belong to internal wind. And also clear internal wind, 石决明, 牡蛎, 龙骨. So we have a lot of herbs subduing liver wind. And then clear heat from the liver, 下枯草. And then we go to 黄芩, clear internal heat. Then we're talking about the kidney relationship with the liver. Liver have some issues. Yeah, liver have some issues. We say for 5 elements, liver belong to the son, kidney belong to the mom. Excessive heat in the liver, they will take the energy from the mom and cause mom deficiency. So same time, we need to tonify the kidney. So 杜仲、牛膝 and even 桑寄生, that's tonify the mom, tonify the kidney. G5 is pretty good herbs. Go to the head, go to the orifice. So that's generally for the formula here. And modifications, and the constipations. These kind of constipation, it must be excessive heat kind of constipation. So that's we adding 大黄there. And more dizziness, yeah, more internal wind. We're adding another subduing internal wind herb, 珍珠母. And dry mouth, dry throat. That means more heat in the damaged body fluid. So we're adding some in nourishing curves there. And if some numbness in the terminal means the lymph, so that's the channel kind of blocking there. So Dilong is pretty good one to open the channels. Then we're still talking about acupuncture treatment. So acupuncture, excessive heat in the liver. We need a clear heat from the liver. And certainly we can clear heat from the gallbladder. So that's gallbladder 22, especially wind points. And also we can clear heat from LI11, clear internal heat. Then we're talking about the liver have issue. We may cause kidney deficiency. So we go to the kidney to tonify and generally tonify. So then we're talking about manipulations here. So still we have more like gallbladder points we can use instead of gallbladder 34, 38. Yang Fu is gallbladder 38. We are putting here. So we could use gallbladder 40, gallbladder 43. And for severe kind of hypertension, we can add in instead use gallbladder 20. We can using do 14, clear more heat inside. And for more liver heat, we can add in liver 2. Nausea, vomiting. Nausea, vomiting. We know liver issue pretty easily attacking the middle jiao and cause the middle jiao disorder. So in that case, patient may be nausea, maybe vomiting. Then we can add in PC6. And even we're talking about ren jiao, good for regular middle jiao. Heart palpitation. Yeah, heart palpitation. We can add in PC6, and we talked about before. Ren 17. Always good one. And if patients especially have hypertension at night, that means insufficiency problems. So that's we add in kidney 6. And dizziness, we add in do 20, like a local points in the dizziness. And patient have more tenderness in the shoulder area. We can add in gallbladder 20. Severe kind of liver kidney indifference. We can add in spleen 6, 3 in nourishing points. So we have a lot of manipulation way we can treat different kind of problems. So that's for the pattern. Let's go another pattern. Another pattern is phlegm fair pattern. So patients still dizziness, still had distension kind of feeling, and also feel pressure feeling in the chest, nausea, vomiting, and possible some phlegm coming out. and the bitter taste in the mouth. So basically, phlegm combination with the heat, and maybe have more germs. The tongue, the tongue. So maybe some pale tongue, but maybe right tongue, or maybe right tip, or maybe on the side part. And the yellow coating, and sometimes greasy, greasy, moistening, greasy. And the very pulse, slippery pulse, and rapid. So that's basically is a heat combination with the phlegm together. So we need clear heat and transform phlegm and soothing the liver, and we try to make the blood pressure go back to normal. So the formula we use for this condition is 黄连温胆汤 plus. So mainly we clear heat from the liver still, but this pattern combination with the phlegm in there. So 夏枯草 still clear heat from the liver, and 决明子 relieve internal wind, and 西香草 so still clear remove internal wind. 黄芩 clear heat, 半夏 result phlegm. 石菖蒲 is pretty good herbs, open the orifice. They will open the internally 脏腑 orifice, like a heart orifice. Also open the head orifice. So that's we can use. And 胆南星 still result phlegm, 陈皮 竹茹 result phlegm, 茯苓 tonify spleen function, spleen not working, TNT not working, and phlegm generation. So we tonify the spleen, remove phlegm. And modifications, modifications. 栀子 still more clear heat from 石胶, 钩藤 remove internal wind, internal wind, and 黄连 clear internal wind. If more heat there, we adding 黄连. And constipations, we still adding 大黄. And more dizziness, more internal wind, we adding 珍珠米. More numbness, we still adding 地龙. And also can adding 三枝, still PTM herbs still go to the channels. That's pretty similar. Upper part numbness, we adding 地龙 with 桑枝, they go to upper. And we know牛膝 go downwards, go downwards with 地龙 together. If lower part of the limbs numbness. And 葛根 pretty good herbs relieve tenderness or hardness on the neck, so we can add in there. Chest pain, chest pain, like we talking about the coronary artery disorder, we still can add in gualo, and also 郁金. 郁金 is 气木名herb. For acupuncture, so we still need clear heat from the liver gallbladder. And then clear heat internally. Then we need some points to remove phlegm. That's stomach 44, still clear heat, and then generally tonify. So we still can modify from there. Severe kind of hypertensions, we still changing gallbladder 20 to do 14, yeah, more stronger clear key. And for more liver fair, we changing liver 3 to liver 2, yeah, liver 2 more clear heat from the liver. And for middle gel, nausea, vomiting, we can add in PC6, and also we say Ren 12 is working very well. Heart palpitations, we still going to go to Parcardin 6. And in the night, we still adding kidney 6. Headache, yeah, headache, especially in the corner, side part, corner part of the head. Thus, oxalate, stomach 8 is there, the local points. Headache in the temple, yeah, headache in the temple. We go to Taiyang acupoints. Headache in the capital eye and the neck. So we can go to bladder 65. So bladder channel passing all the top of the head and passing the neck. So that we can use these points. Certainly, if you like use local points, bladder 10 is still working. And the dizziness, we still can add in Bai Hui. And for the shoulder pain, we still can add in gallbladder 20. So that's for this pattern. That's for this pattern. Then we're talking about the liver kidney deficiency pattern. Liver kidney deficiency mainly is indifferency. And they are pretty commonly coming together. Yeah, kidney indifferency pretty common. But they are pretty commonly with liver indifferency together. When we're talking about 5 elements, we're talking about kidney is the water. Kidney is the water organ. And the liver is the wood. So kidney is the mom of the liver. So when mom have a deficiency, the son will have a deficiency also. So that's the relationship. So that's we're talking about these 2 organ deficiency together. So general symptoms, dizziness, tinnitus, and abbreviation. So dizziness and tinnitus is illness name. They will have a lot of patterns, but here we're talking about the deficiency part. And the liver indifferency, the eyes losing nutrition, so privation. And also insomnia, memory decreased, poor memory. So when we're talking about indifferency, including blood deficiency part. So poor memory usually is blood deficiency, but blood still belongs to yin. And also heart losing nutrition, palpitations, and also numbness on the hand or legs, so limbs. So that's generally deficiency, generally deficiency. And dry mouth, even dry sound. So dryness because deficiency will generate some difference in heat. That heat make the dryness. So that's the difference in heat in it. And also have lower back and knee weakness and sore. And maybe some like menstruation, irregulations problems, and sex losing function problems because kidney essence control the like sex actions. So if we're looking for the tongue, it's right tongue. Usually no coating. Yeah, usually no coating. Or maybe just a little bit coating there. And thinner. The pulse is rapid and serrated, or thin pulse. So that's generally we're talking about indifference relationship with the kidney and the liver. So treatment principle, we need nourishing kidney and the liver in. And then now we're talking about hypertension. We try to reducing the blood pressure. The formula we use, this formula we talking about before. 起居地黄丸 and modified. 加味 modified. So basically, when we talking about 地黄丸、熟地、山药、山茱萸、泽泻、茯苓、牡丹皮 that's 肾气丸 or 地黄丸 the same meaning. And then plus 枸杞子 and 菊花. So that's the formula originally 起居地黄丸. Then adding more ingredients here. 龟板 in nourishing, in tonified. And 牡蛎 bring all the heat go downwards. So that's we modified from there. Then we still can add in some more if patient have the situations. If patient dizziness is more severe and maybe numbness of the limbs. So that's some internal wind symptoms. So we add in 钩藤, 地龙, and 天麻. 钩藤 and 天麻 relieve internal wind. 地龙 go to the channels. If patients pretty dry stool, we can add in some more 黑芝麻 sesame seeds, black color sesame seeds, and 白芷仁 still seeds. So moistening large intestine. Excessive kind of heat causes dry stool, constipation. Usually we add in 大黄, but different kind of dry stool. We better adding some moistening seeds in there because 大黄 working so strong. If liver qi stagnations, adding 酸莲子, moving liver qi. So if blood stasis, we adding some herbs moving blood. 丹参 is good one. 当归 still can moving blood. And certainly we have more moving blood herbs we can add in there. If like more like kidney and heart in deficiency pattern. So before we talking about liver and kidney in deficiency. Now we talking about heart and kidney in deficiency. This kind of condition usually is the condition we talking about heart and kidney disharmony. So patient will have difficult fall sleep, insomnia problems. So we're changing the formula for 天王补心丹。心 is heart, 补 is tonified. 天王 just means powerful here. So dan same meaning like pills and modified 加减. So that's especially working for heart in deficiency and maybe with kidney in deficiency and help people sleep. So still 龙骨牡蛎 bring all the heat down. And 生地 cooling blood nourishing the kidney. 玄参 tonified blood nourishing the heart. And 天门冬麦门冬 that's yin nourishing. 酸枣仁白子仁 calming 神 help people sleep. Then we have blood tonified herbs also. We say yin including the blood. So 丹参当归 nourishing blood, moving blood. 茯苓 middle 椒 tonified. 远志 calming 神. 桔梗 is bring qi upward. Help qi circulation. 人参 qi tonified. 黄连 clear heat. So that's basically in deficiency kind of patient. They will have some degree kind of heat inside. So 黄连 clear heat. If patient in the condition in deficiency, more severe heat rising up. Severe kind of heat, we call it fever. In deficiency, fever rising up. So that kind of condition, we can add in more clear heat herbs. So that's we call use 知柏地黄丸 modified. This formula we talked about before also. So that's basically is 地黄丸 or 六味地黄丸 the same meaning. Plus 栀子 and 黄柏 clear heat herbs. So 生地黄 in 知柏地黄丸 and also they use 熟地. 生地 more clear heat, 熟地 more nourishing and tonified. So we can use together. And then we can see 石决明 distinguishing internal wind and also heavy herbs bring the heat go down with 牡蛎 together. Certainly you still can use 龙骨牡蛎 together. But 石决明 more go to subduing some wind. Severe kind of fear can cause the internal wind. And 何首乌 in nourishing, blood nourishing. 桑寄生 kidney tonified. 女贞子 kidney tonified. And yin tonified. 龟板 kidney and yin tonified. 山竹鱼 originally in 地黄丸 and 牡丹皮 clear heat in the blood, also in our originally 地黄丸 and 黄柏知母 clear heat, 白芍 blood mercy. So that's basically if severe kind of fear rising up, we can use this formula, more kidney tonified and more clear heat. So acupuncture, the acupuncture treatment, truly we need working for the kidney. That's the mainly pattern, kidney in deficiency. So, and in tonified skin 6. And also for the liver, we can go to gallbladder 39. Gallbladder 39 is especially marrow points, confluent points, tonified marrow. So we say kidney holding the bone, control the bone, bone control the marrows, marrow supports to the brain. So that's the kidney deficiency. We can nourishing the marrows there. And generally qi tonified, stomach 36, and clear heat Li11. So we still can modify from the formula here, from the like the points from the. So if patient more severe kind of kidney deficiency, we go to back row of the kidney to tonify and nourishing the bladder 23. And the patient more severe liver blood deficiency, go to back row of the liver, bladder 18 to tonify. And if patient heart insufficiency, especially cause patient difficult fall asleep or insomnia, can go to heart 7 to 25. And if heat rising up, deficiency kind of heat rising up, we can use kidney 2. So kidney 2 is the flare point of the kidney by 5 elements. So we can clear some kidney heat from kidney 2. And if patient have liver yang rising kind of conditions, we can subdue liver yang from gallbladder channel, gallbladder 20, or sometimes I like to use gallbladder 34. Gallbladder 34, or maybe 43. Both of these points is pretty good. Clear some heat from liver gallbladder channels. If patient has severe kind of hypertension, do 14, especially can help. And also we have some ear points, especially working for hypertension also. You can check in the chart for the ear map there. We have special points and even line working for the hypertension. And if patient knows they are vomiting, adding PC6, that's open the chest, and heart palpitations, we still can go to PC6. That's basically open the chest. They're working for the like upper jaw and the middle jaw also. If you try to relieve like nausea, vomiting, basically you can combination with speed 4 together. If you try to work for the heart palpitations, to better with Ren 17 together. So that kind of combinations. 17. So for patients' hypertension, especially at night, adding kidney 6. So that's the mainly nourishing kidney endpoints. So patient have trouble mainly in the night, mainly is in deficiency. And the headache, headache. If patient headache, special on the corner of the head, that's the special location, stomach 8. So we can add in stomach 8 as a local point there. Then we're talking about a pattern. We say 冲 and 人 like disharmonized there. So this pattern usually happens for the female around menopause time. And then they got hypertension. So the symptoms still dizziness, headache, and some heat flushing, and the emotions either angry, hot flushing, night sweating, and dry mouth, dry throat, and difficult to fall asleep or fall asleep. And also possible have lower back pain and knee soreness and weakness. So that's basically special happens menopause time, maybe before, maybe after. So that's the symptoms we talk about, mainly relationship with 冲 and 人 functions. Pale red tongue, like a pink tongue, and without coating, and very pulse, but thinner. So this is the pattern both kidney and liver in and yang deficiency. If we go to organ diagnosis. So that's we're talking about this pattern is more relationship with aging people, especially for female. And then some heat rushing up. So our treatment principle is a regular 冲 and 人. The formula especially working for these problems is 二仙汤. We call it 二仙汤 because there are 2 herbs inside, especially 含仙, 仙毛 kidney yang tonified, and 仙灵皮 still kidney tonified. So that's also named 阴阳货. So that's kidney yang tonified. And we also have 八几天 kidney yang tonified, and 当归 blood tonified, 杜仲 kidney tonified, 牛膝 kidney tonified. So we have lot of herbs to tonify kidney here. So when we talking about regular 冲 and 人, 冲 and 人 function still relationship with kidney. And then we have another 2 herbs to clear heat, 黄柏 and 知母. So that's mainly clear heat from lower jaw and clear indifferency kind of heat, not excessive kind of heat. So we still can modify it from there. Yeah, still can modify from there. So TTM treatment is kind of special kind of treatment. Different people will use different treatment by different situations. That's generally. So if patient have qi deficiency, we adding qi tonified herbs, huang qi and dangshen. If patient have night sweat and hot flushing, so we can add in some astringent herbs and also bring the heat go down herbs. Fu xiaomai belong to astringent herbs, stop sweating, and mu li bring the heat down. If patient have spleen deficiency, then cause the losing stool. So adding Fulin and Shanyao. Middle jaw tonified. If patient have symptoms relationship with blood stasis, we adding Taoren Honghua. So we have a formula we call Tao Hong Si Wu Tang. That's the special formula moving blood without blood stasis. Taoren Honghua is the king herb. So here is Tao Hong Si Wu Tang idea. If liver qi stagnation, we still adding 川念子. Then we're talking about acupuncture, acupuncture treatment. So qi tonified, we go to Ren 6. And generally tonified, Cong and Ren tonified, Ren 4. And yin tonified, Spring 6. And clear some heat from the liver 2. And pericardium 6, we say they're working for a lot of conditions. Open the chest, regular middle jaw. So for these kind of patients, they usually have some chest pressure and also insomnia. So we're adding pericardium 6 there. And then we still modified from there. So deficiency heat rising up, we still can add in kidney 2. We talked about already. So that's we say changing from liver 2 to kidney 2. Yeah, 行间 is the liver 2. That's basically we clear heat from the liver, we go to liver 2. If we're thinking about that kind of heat coming from indifferency mainly, we go to kidney 2. And severe indifferency, we can go to Yuan south points of the kidney 3. And heart flushing or severe kind of hypertension, we still go to do 14. We talking about these points already. Night sweating, go to heart 6. For TCM, sweating is the fluid of the heart. for our foundation. Yeah, for foundation, sweating problems, relationship with the heart. So thus we go to hard points to stop sweating, especially in the night. So these points we can say easy. What means in is in time, in time problems. And hypertension, especially at night, we go to kidney 6. Kidney 6 still in nursing, 25 points. And the headache at the corner still same. We go to stomach 8. And the headache in the temple area, temple area. So that we can go to acupoints of 太阳 there. And the dizziness go to 220 百会. So that's some modifications, including patient situations. When we're talking about blood stasis part, blocking the channels. So usually blood stasis pattern is more severe compared with other pattern, and usually is chronic problems, long-term problems. Blood stasis, we say that kind of usually causes the pain. Yeah, usually causes pain. Severe kind of pain in the fixed location. That's blood stasis kind of pain. And sometimes you can see some like a spandrel kind of vein on the body part. So what that means? So that kind of vein show up pretty smaller, like a spandrel. And also, like we can see possible cause some bleeding problems. And the stool, the face may be dark color there. And maybe dark pupil kind of tongue. And also maybe choppy pulse. So that's generally blood stasis kind of pattern. And then patient have hypertension. So blood stasis pattern is more complicated pattern or more severe pattern compared with other patterns, and truly more difficult to treat pattern. So certainly removing blood and remove blood stasis and try to decrease the blood pressure. The formula we use 血腐毒鱼汤 modified. We're talking about the 桃红四物汤 before. Moving blood. Yeah, 桃红四物汤. I believe you are pretty familiar with 四物汤. So in the 四物汤, yeah, we have 生地黄, we have 当归, 川芎, and another one should be 白芍.白芍not in here, but that's 四物汤. That's 四物汤. So we have most ingredients here for 四物汤. The 四物 basically we need 4 ingredients. but they changing 白芍 to 赤芍. 赤芍 more clear heat. So basically we have 四物汤 idea in here. And 阿丁桃仁红花 that's 桃红四物汤 that's 桃红四物汤。血府逐鱼汤 is modified coming from 桃红四物汤。Still the formula moving blood. So adding more herbs here. Yeah, just adding more herbs here. And this formula here, they even modified from 血府逐鱼汤. So like 桔梗、郁金、荆芥 is more qi moving here. And 丹参 moving blood, tonified blood. 龟板、鳖甲 kidney tonified. So that's basically modified 血府逐鱼汤. Then we still modified from there. For chest pain. Chest pain is the condition. Still blood stasis. Severe kind of blood stasis. Chest pain, we adding 失效散. 失效散 is the formula name. 效 is smelling. 失 is losing smelling. Because patient pain, they couldn't smell, couldn't laughing. So that's the formula. Moving blood, yeah, moving blood. So 失效散 only have 2 ingredients inside. 五灵脂 and 蒲黄. Both these 2 herbs is moving blood herbs. Together we call 失效散. So that's for moving blood relief pain. And if patient have kind of pupil color, a little bit pupil color on the limbs, on the nails, and the heart rate usually is increased. So advanced medicine, that's basically the condition is oxygen levels decreased in blood circulation. For TCM, still the condition blood stasis. So that's we can add in 三七. Yeah, 三七 is pretty good herbs. Yeah. Stop bleeding, but not cause blood stasis. They move in blood and stop bleeding. So that's pretty good herbs. So when we use 三七, 三七 is a little bit expensive kind of herb. So basically we powder it and we cooking other herbs first, then put the powder to the decoction. So that's only 3 grams in here because we use as the powder. And for qi deficiency, we still add 黄芪 and 党参. That we talked about already. Then we're talking about acupuncture treatment. Acupuncture treatment, 3-6, that's pretty good, 25. in 25 points there. And the bladder 17, diaphragm 数, but that point especially for moving blood. We can use tonified blood and moving blood. And also another point, sprinting. Still can tonify blood and moving blood. It's depending on your needling technique. If you try to tonify, you use tonify technique. If you try to moving blood, you use reducing technique. And also, we still go to PC6 and stomach 36. Qi tonify, qi moving. Qi moving, blood moving. If qi not moving, blood not moving. So that's we need a moving qi. If we don't have enough qi, qi is still not moving. So we also need a tonified qi. And these conditions, patients still possible have some heat inside. We can go to LI11, clear some. So we still can modify it from here, to see patient's conditions. If patient more kidney deficiency or generally kidney deficiency, we can go to biopsy of the kidney. So that's generally that's kidney 25 points. Don't have enough space here. Then we say, if liver blood deficiency, we go to biopsy of the liver. Certainly, deficiency problems we still tonify. And if heart indifferency, we can go to heart 7, even heart 6 can working for heart indifferency. If deficiency kind of heat rushing up, we still go to kidney 2. And if patient have liver young rising kind of condition, we go to gallbladder channel to subdue liver young. And if liver fat, that means excessive kind of heat rushing up, we go to liver 2 to clear heat from the liver. And still severe kind of hypertension, we still go to do 14. And especially hypertension at night, go to kidney 6. That's basically pretty similar we talking about before. Then we go to the pattern. Flame blocking. Mainly is flame blocking. So flame blocking, basically people feel cloudy in the head and maybe in the eyes, and also dizziness and heaviness. Heaviness kind of headache. And chest blocking, pressure in there. It's possible nausea, vomiting, or appetite. And most people overweight and fatigue. Maybe some phlegm coming out. If we look in the tongue, it's more moist in there. and sometimes greasy. And the pulse may be very pulse, maybe sleepy pulse. So that's because phlegm inside. So this pattern is still possible combination with other patterns. So that's for phlegm pattern. Treatment principle, dispersing dampness, transform phlegm, and low blood pressure. So dampness is all over body fluid retention. Phlegm is local. They are pretty commonly coming together. So that's both abnormal water disorders. So the formula we use, 半夏白术天麻汤. So that's the formula name. We got the 3 herbs in there already. So 半夏 result phlegm, 薏仁 dry dampness. Oh, 半夏 here. 半夏 result phlegm, 薏仁 dry dampness. 白术 tonify spleen functions. People have water problems, whatever dampness of phlegm, that's basically their spleen functions is losing. And Fuling still with the Baizu together tonify the spleen functions. And the Fuling also can reduce some extra water. And Tianma, subduing internal wind. People have phlegm, usually cause the dizziness. Dizziness belongs to some internal wind symptoms. So that's why adding 天麻 there, especially for phlegm disorder. Then we talk about 橘红. I think you are pretty familiar with 陈皮. Orange peel, yeah, orange peel. 橘 is the orange, 红 is red. Like a red yellow color kind of orange peel. That's coming from Fashion kind of orange peel. And if we storage for long term, at least over 2 years, then we call it 陈皮. They have the similar function. Yeah, they have the similar function. So that's 橘红 here. If you don't have 橘红, then you can go to 陈皮. So 橘红 basically, orange peel is the outer part of the orange peel. That's the red color in it. And then 甘草、生姜、大枣 harmonize the whole formula. Then we still can modify it from there. Yeah, modify from there. If patient have more wind symptoms there, like we say severe kind of dizziness, yeah, severe kind of dizziness, internal wind condition. So we can add in 钩藤 and 石菖蒲 and 姜蝉, subduing internal wind. And the patient more blood stasis condition with adding tension and tension moving blood. So acupuncture treatment, acupuncture treatment. The points, stomach 36, stomach 25, and LI11 still clear some heat. So everything not moving will be generate some heat. PT6 open the chest, stomach 40, spleen 9 specially remove dampness of phlegm. So basically the changing modifications with last one the same. We are not repeating that again. Then we're talking about qi and yin both deficiency pattern. Qi and yin both deficiency, they will have symptoms, both qi and yin deficiency. And the patients still dizziness. The symptoms worst when people do some physical activity because they are qi deficiency. They use more qi, cause the symptoms more worse. And also maybe tinnitus, maybe dry eyes. So these usually 2 eyes both dry. That's an internal disorder. If local disorder, just 1 eye is dryness. And also dries out. So that's coming from yin deficiency. And could be have hot flushing and fatigue. Generally feel weaker. And can have sweating and short breath. So that's patient have both qi and yin deficiency symptoms. The tongue is pale tongue and a little bit swollen there, and the teeth mark on the side of the tongue. So that's usually coming from qi deficiency, water retention. And also possible no coating. So that's coming from yin deficiency. And the pulse thin and force-like. Weaker pulse, possible rapid pulse. That's because like a deficiency heat inside. So treatment principle tonify both qi and yin. Tonify both qi and yin, we have pretty good formula we call 八珍汤. 八 is 8. 8 ingredients inside and plus other herbs. So where the 八珍汤 coming from? 四君子汤 and 四物汤. 四君子汤 qi tonified. 四物汤 blood tonified. So together we call 八珍汤. So let's see here. 党参、白术、茯苓、甘草 together. Another one is 甘草. That's 四君子汤. And let's see, 白芍, 熟地, and should be have 川芎。That's 四物汤。So they only have 2 ingredients in here, but the basic idea in here already. Then adding more herbs here, basically, they modified from there. So 黄芪 still qi tonified, and 代赭石 subdue yang. So that's still treat hypertension kind of condition. 女贞子 yin tonified. 汉莲草 yin tonified. 山药 kidney tonified. 山竹鱼 kidney tonified. So idea is 肾气丸 here. So still have kidney tonified herbs here. Yeah, 肾气丸 idea here. And 菟丝子 kidney tonified. So that's basically both qi and blood deficiency. We use the formula here. And we still can modify it from here. If blood stasis, we still can adding, yeah, we're adding 丹参 moving blood. 鳖甲 belong to yin tonified herbs. So when we're moving blood, we need to tonify some blood. That's kind of balance there. And if liver qi stagnation, we're still adding 12. And the damp heat, we're adding 苦参 and 黄柏 clear heat. Then we're talking about acupuncture. Yeah, we talk about acupuncture. So qi and yin both deficiency and blood deficiency. So we need more tonified points there. So all the points we talked about before already. And modify from there. Night sweating, we talked about already, heart 6. Yeah. And the kidney deficiency, back to kidney. Liver deficiency, back to of the liver. And the heart deficiency, yuan south points of the heart center. And the deficiency heat rushing up, kidney 2, we talked about already. And the liver yang, hyperactive, liver 3. Liver 3 also moving liver 2. So next part, we talk about the yin yang both deficiency. So this pattern, patients still dizziness, tinnitus, and deafness. And the 5 center heat, that's yin deficiency symptoms. And also aversion to cold, that's yang deficiency symptoms. So basically just have both yin yang deficiency symptoms together. And maybe have some swollen on the lower limbs, still caused by yang deficiency, water retention, yeah, especially edema around the ankles. And maybe have some sex functions decreased, and frequently night urination. So the tongue is depending. If more yang deficiency, the tongue will be more pale. If more yin deficiency, the tongue may be red. So totally depending the situations. And the pulse, deficiency kind of pulse like, and may be floating. Thus, iodine deficiency may be caused floating pulse. And maybe thinner rapid pulse. So still depending what kind of deficiency is more severe. So treatment principle, we need tonify yin, tonify yang, and low blood pressure. The similar formula we talked about before. 肾气丸 and 二仙汤 put together and modified. So basically, we're talking about these two formulas already. So we are not repeating it here anymore. And modified, modified. Still the same. And acupuncture, acupuncture. We go to kidney tonified, both yin yang deficiency. Mainly, we need to go to kidney tonified, and we also need like tonify qi, tonify blood, and ren 5, ren 5, below ren 6. That's still tonified points there. And the modifications still similar like before. So we're talking about high blood pressure. So basically treatment, we need combinations TCM with the medicine together. So that's basically we say we help each other. We are not only like use TCM herbs or TCM acupuncture treatment, but we use together maybe can decrease the dosage, use the drugs, and also reducing some side effects of the drugs. So that's basically we talking about the combination use TCM and with the modern medicine. So the same for the hypertension kind of patients. So that's we finish the hypertensions.